Hey, what's going on, guys? Today I'm going to talk about some different setups for split squats and how they influence the body position and the different tissues that we're targeting. So the first setup we're going to talk about is going to be the front foot elevated split squat. So there are many benefits to this front foot elevated setup. The biggest probably being that it's going to push your center of mass backwards and allow you to be in a better stacked core position. So if you think about somebody who is in that kind of anterior tilted pelvis all the time, lower back extension, a lot of times their hips and their back are kind of jammed up. Sometimes they might have some knee pain because all that weight is shifted to the front of their joint. So this is going to be a great place to start with those people because it's going to allow them, the second I put this foot up here on the block, it's shifting my center of mass backwards. That makes it a lot easier for me to get into a stacked core position, pull my pelvis under me, get my lower back kind of into that neutral position, and then now just coming straight up and down here. So what you'll notice is I'm in a little more hip flexion at the top and at the bottom than a normal split squat. And this is going to be great for just stretching out the tissues, the glute tissues, hamstrings. So because we're in that kind of 60 to 110 degrees of hip flexion, we're also biasing more internal rotation of the pelvis, so the closing of the pelvis. And if I wanted to do a little more of that, bias more of that internal rotation, all I would do here is just rotate my pelvis towards this stance leg. I'll reach this dumbbell toward the midline and come straight up and down from there. So when I'm doing that hip shift, I'm just going to get more internal rotators, more adductors on that stance leg. So if we're thinking about this, from a client perspective, if I'm seeing somebody who is always sort of toward the outside of their feet, they're always sort of supinating their foot, knee out here, we're going to want to try to get them to close off their pelvis, internally rotate, find their adductors, find some pronation on that front leg. So those are the kind of people I'm really going to want to try to get them into that hip shift and find that position a little bit better. And on the flip side, if I have somebody who's always kind of caved in here and in more pronation all the time, I'm going to want to try to restore some of that supination, get their glute firing, get in some more external rotation of the pelvis, and that's where I'm going to be a little bit more posterior shift, maybe more neutral with my pelvis, and that's going to allow it's basically going to force their position and them working those tissues that we're looking for there. One potential drawback of this variation is if people struggle to kind of decipher where their weight's supposed to be. So this, because your weight is posterior shifted backwards, there is naturally going to be more weight on your back leg than in a normal split squat. But sometimes people are just going to load that back leg a little too much. So that can be something that we might want to think about a little bit if that is someone does struggle with that this variation might not be best for them. The next setup we're going to talk about is going to be a front heel elevated split squat. And to be honest, this has a lot of the same benefits as the front foot elevated split squat. It's just going to be slightly different in the way we're setting things up. The main difference being my heel is elevated with this compared to my entire foot. So I'm putting my foot in a little bit of plantar flexion. I'm in a little less hip flexion than the front foot elevated split squat. So it's sort of an in-between from front foot elevated to rear foot elevated because I'm still giving myself a little bit of a posterior shift in my center of mass. It's still making it a lot easier for me to get into a good stacked core position, my pelvis being under me a little more, and it allows me to stay a more vertical motion. So I'm not moving through my hips here. I can stay straight up and down, but my weight isn't shifted quite as much as it is with a front foot elevated. So I'm starting to move more towards that midfoot. So I'm still biasing more internal rotation of my pelvis, and I'm still biasing more of that decelerative muscles, getting that length out of the glute and the hamstring. I'm just not quite as much posterior shifted, moving a little more towards that midfoot, and it makes it really easy to get into a vertical motion with this. So I've seen a lot with clients and athletes. This one is sometimes an easier one to figure out than the front foot elevated split squat, just because there's less going on compared to them doing a normal split squat. All they have to do is step on this heel wedge, and it becomes really simple from a perspective of motor competency. They're not trying to figure out where their weight is quite as much. It's a little easier to load that front leg, but I am still biasing all the benefits of the front foot elevated split squat. So all those same benefits, it's just easier for people to figure out a lot of times. So the last setup we're going to talk about is going to be the rear foot elevated split squat. So this rear foot elevated split squat variation is going to be basically the opposite of those first two. So instead of posterior shifting my center of mass, I'm actually going to be shifting my center of mass forward when I bring this leg, elevate this leg back on the stand. Okay, so I'm getting in a little more of a torso lean naturally. It's putting me in kind of an acceleration position. So I'm starting off, I'm going to be kind of internally rotating with my pelvis, and then I'm going into external rotation at the bottom here, driving out of the hole. So this is going to be a great setup for people who need to work on their power getting out of the bottom, power getting out of a cut. They need to work on that first step strength. This is going to be really working concentrically with those quads, glutes, and hamstrings, and really putting you in a position to produce a lot of power. From a movement standpoint and a sensory motor competency standpoint, if people struggle with that extension bias, that kind of anterior pelvic tilt, this is not going to be as good of a setup for them because it's basically going to feed that bias. So if they're already extended here, when I elevate this back foot, it's actually going to make it a lot more challenging already than a normal split squat to keep that core position. So if they struggle at all with normal squat variations and maintaining their pelvis and rib cage alignment, this is only going to make it worse. So this is going to be a lot tougher from a sensory motor competency standpoint, but it is going to be a great exercise for really loading those tissues and putting ourselves in a little more of that acceleration position. So to sum things up here, instead of focusing on our cueing and how we're coaching things from a verbal standpoint, we would much rather constrain the movement, set people up in a good position to target specific tissues, make it easier for the athlete or the client, make it easier from a coaching perspective to make sure they're getting what they want out of the exercise and progressing, and we're doing a good job of constraining the movement to make sure that we're getting what we want out of it.